In this video, we'll be going over the medications for anemia. They are also called hematopoietic medications, such as iron, B12, folic acid, erythropoietin, colony-stimulating factors, and an antimetabolite drug used for sickle cell anemia. One of the main supplements used for anemia is iron, because iron is needed to make red blood cells. It's actually what makes red blood cells red. If patients are iron deficient, those red blood cells under the microscope actually look a little bit pale. The forms of iron are slow or gentle iron. It could be called by its chemical symbol, Fe, or by its name, ferrous sulfate. Iron is also available with vitamin C, which helps absorption. It can be given by a tablet or liquid form. The dangers of taking iron is GI side effects. Constipation, just does not make them feel good, nausea, vomiting, can also change the color of their stool to black. Now, we don't want them concerned about that, but if they do come in complaining of dark stools, the first thing we have to just double check is that it's not blood, because black stools is a sign of GI bleeding. If we've ruled that out, then we can just tell them it's their iron and they don't have to worry about it. They should be taking their iron on an empty stomach unless they're having the GI issues. The vitamin C is available with the iron, or they can also just take iron with orange juice to increase absorption. They should not take it with dairy or calcium supplements that blocks absorption. And if they're using the liquid form, they should take it with a straw to avoid staining of the teeth. If the patient is complaining of constipation, that's probably one of the biggest complaints with iron. There are slow iron forms which help with that side effect. Iron dextran is another way that patients can take iron. However, it's saved for the patient that is severely iron deficient, or somebody with blood loss like GI bleeding or from hemophilia. It is given IM or IV. The danger is that it can cause anaphylaxis. So the side effects on the slide are all side effects of anaphylaxis: the irregular breathing or pulse, the swelling in the face, the puffy eyelids, the back pain, the fever. All of that is a bad reaction. And so as a nurse, the duty when giving iron dextran is to give a test dose first to make sure there's no response like that. If they are okay with a test dose, then after an hour, we can give the full dose. If they do start experiencing side effects, we are supposed to stop the medication, call the provider, treat as anaphylaxis. Another word of caution is usually these people are receiving blood transfusions at the same time, especially if it's iron deficiency from blood loss. That, coupled with the iron dextran, can cause iron levels to become toxic, and the patient might need chelation therapy. Chelation is just the removal of iron from the bloodstream. Vitamin B12 is another supplement used to help with the red blood cells. Examples are B12, cobalamin, which is the other name for B12, available by IM, nasal spray, or PO forms. The dangers with overdosing on this vitamin is kind of hard to do, but the biggest one would be this tingling sensation in the hands and feet. B vitamins protect your nerves, but at the same time, if you take too much, they can mess with your nerves. So always connect the B vitamins with nerve signs and symptoms. The duties that the nurse should know about is if they have a B12 issue that is caused by a GI problem, like the B vitamin gets absorbed in your gut. So if the stomach can't absorb that B12 for some reason, maybe just they're missing that part of the stomach that's supposed to absorb it, it doesn't work very well, or they have the genetic cause of B12 anemia called pernicious anemia, which is discussed in the anemia video, then they have to get their B12 by IM injection. PO would not work for those people that can't absorb it through their stomach. However, if the B12 just needs to be supplemented and they have no GI problems, they have no pernicious anemia, then they can just increase their B12 PO sources through a supplement or by eating more B12 foods like meat. B9 or folic acid is also used to supplement in pretty much kind of the same way as a B12 action. B9 is called folic acid, available by PO, IM, IV, or sub-Q forms. Again, if we're looking at the dangers, there's some GI issues there, and then also some neuro confusion, irritability. Hard to overdose on this vitamin, but we just want to know the side effects just in case. So we're going to watch for any GI irritation. Again, if the gut is not absorbing this medication, the client needs to get a different form other than PO. If the GI issue is not a problem, then of course we can just do PO forms. Another category of drug is erythropoiesis stimulating agents. Erythropoietin is produced naturally in the kidneys, and that stimulates the bone marrow to make red blood cells. So man-made erythropoietin is used to treat anemia, especially in kidney failure. It can also be used to prevent or treat anemia post-surgery, anemia caused by medications, or anemia caused by viruses like HIV and cancer. The example names are epoetin alpha, and it's available by injection, usually sub-Q. The dangers with giving this med is more so a reaction, a cardiac issue, chest pain, heart failure, blood clots, weight gain, so a fever. So just look for that quick response to this medication. Usually it's pretty well tolerated though. The duties are that the nurse should be aware of seizures within the first 90 days. They should be careful driving. Of course, monitor the heart. There's a lot of cardiac issues that can be associated with this. As far as the med goes, we need to keep it in the fridge, and we give it sub-Q every day initially, and then it can go to usually 3 times a week. And we do want the patient to also take their iron and B vitamins for the medication to work the best. All those medications, all those hematopoietic medications are usually given because they complement each other. There's also medications called colony stimulating factors. These are usually saved for aplastic anemia. Aplastic anemia, as a reminder, is when the bone marrow is not making the red blood cells. So this medication actually stimulates the bone marrow. It increases the growth of those stem cells to produce the red blood cells. It will also have the side effect, well, not side effect, but it can also be used to increase white blood cells in people with leukemia and leukopenia because it's just overall stimulating the bone marrow. Examples: sargramostim, filgrastim, you might have seen that on the commercials, Neupogen, and pegfilgrastim. The dangers of stimulating the bone marrow are spleen enlargement. It can cause a ruptured spleen, easy bruising, unusual bleeding. It can cause fever, stomach pain, back pain, a lot of pretty intense reactions, rapid breathing, short of breath, capillary leak syndrome, sudden dizziness. Basically, the message we can get here is it can cause a lot of issues. So just anything, GI pain, dizziness, respiratory issues, changes in their urine, they should call the doctor and let the doctor know. So what is our duties? Our duties is to make sure they know what the side effects are, especially with the spleen. Make sure they know that severe pain in the left upper stomach that spreads to the shoulder is a sign of spleen rupture. They need to know that if there's bleeding, shortness of breath, kidney issues, signs of infection, dizziness, that they're supposed to stop that medication, call the provider right away. This is another med that needs to be kept in the fridge, and it's also given sub-Q. And they need to know that the medication is a single dose vial and to throw away any remaining medication. Last med we're going to talk about is the antimetabolite used for sickle cell anemia. What this does is increase the number of fetal hemoglobin. Fetal hemoglobin takes much longer to sickle and does not deform as much compared to adult hemoglobin. and thereby it reduces the number of sickled cells that are traveling in the system. It can help prevent pain episodes and need for blood transfusions, but it is not curative. Be careful though, because it is an anti-metabolite. Anti-metabolites, if you think about the word, stop metabolism, stop formation. It will stop DNA production. So we have to be careful when somebody's on this medication. They cannot get pregnant. It will stop that DNA in the fetus from replicating. Other uses of this drug are pictured on the slide if you're interested, but I want to stick to the anemia use right now. The medication is called hydroxyurea, and the dangers is that it can weaken the immune system, and that's because it's stopping even DNA for your immune system. So your immune system can't replicate itself and will weaken. And therefore, the biggest thing is to watch for signs and symptoms of infection. I already mentioned the fetus side effects, so it can cause birth defects. And if your immune system is not working, not only can you get infection, but cancers will be allowed to grow. So watch out for some skin cancers. The duties. You don't want to touch this medication. It can mess with the DNA on your hands if you do. So we're going to handle this with gloves. We're not going to open those capsules or crush or chew. If the powder does get on any area it's not supposed to, you're going to wash that with a damp cloth and discard it away from pets and children. We're going to monitor the client for signs of infection, bleeding, cancers. Because there is a risk of skin cancer, tell your patient to wear sunscreen, protective clothing. Do not give to a pregnant person, so you want to double check that they're not pregnant before you start this medication. Avoid pregnancy when on this med. Make sure men and women are both using birth control. And women should actually continue to use birth control at least 6 months after the last dose. And also, because of the immune compromise, the patient should not get any live vaccines while on this medication. And a reminder, those live vaccines are MMR, varicella, and zoster. That's it. We went over all the anemia medications. Hopefully you took some screenshots along the way, and we'll print them out and use them as med cards. If you enjoyed this video, hit the like button and subscribe to our channel.